Good afternoon, and welcome to this edition of the Casa live streaming event about the impact of the pandemic on mental health. My name is Leslie McDonald, and I'm going to be your host and moderator for this entire series. It is brought to you by Casa, Child, Adolescent, and Family Mental Health. And of course, for those of you who know, Casa is a very well-respected not-for-profit organization that's been providing assessments and treatment for children and families in Alberta for more than 30 years. So this live stream is about sharing what Casa has in terms of resources and knowledge to bring you accurate, reliable information during this time of real uncertainty and for so many of us, such anxiety and stress. And we feel it's more important than ever to talk about mental health, about what we're feeling, and to be able to share with others that knowledge. This live stream is also a continuum of our public forum discussions with the Dr. Roger Bland Lecture Series, which is a monthly event that's been running for 2 years now. Our goal has always been to inspire dialogue, hope, and wisdom, and to reduce the stigma faced by people with mental health. We want to thank our partners in this series, the University of Alberta, the Edmonton Public School Board, and the Alberta Alliance on Mental Illness and Mental Health. And our topic today is about addictions. We have a CASA expert on addictions, and we also have two people who are going to bring us their lived experiences, some pretty compelling stories to illustrate what that looks like. Of course, we'd like your perspective, your questions, your comments. You can do that through the live stream chat function. On your screen, you just click on the chat bubble icon. It's in the upper right-hand corner. That will open up a new window, and in the bottom right-hand corner of the screen, you'll then see the Join the Chat button. And as a guest, just join in as a guest, and then you're in. And also, you can text us if you prefer at 780-709-6776. Our first guest today is Margot Crane. She is the clinical lead for the Concurrent Addictions and Mental Health Program, or CAMP, at CASA. And Margot, I am so pleased that you're able to join us today. And of course, you were the first person I mentioned that I talked to when I first started learning more about CASA, and you taught me a lot about addictions. First of all, give us an idea of exactly what CAMP is, what it does, who it serves.
Sure. Thanks, Leslie. I'm glad to be able to chat with you today. So CAMP is what we call an outpatient program. So the clients that come to our program still live at home and they access services at CAMP. Our office is located in the downtown office, so it's easily accessible by LRT and bus. We're a voluntary program, so the kids that come to us are not mandated by the courts, dragged kicking and screaming, so they need to want to be there as much as they can. So we do prevention work, we do early intervention, we also do treatment. So like you mentioned, we do work with youth with concurrent disorders. So what that means is that they have a mental health concern and an addiction or an addictive behavior, or are at risk of developing one. So we know that 50% of people by the age of 14 are already exhibiting mental health concerns, who have them in later adulthood, and 75% of people who have mental health concerns in adulthood start to exhibit those symptoms before age 18. We also know that the younger a person starts substances, the more likely it will develop into an addiction. So there's a really complex interplay between substance use and mental health, and they can both exacerbate or precipitate the other.
So what age group are you with in this program?
So the youngest I would say we've had is 10, but we typically have our cutoff at 12 because there are different types of therapies that you would do with younger kids that we don't always have all the different toys and the different play therapies available to us. So typically about 12, and then we end around age 18.
Okay. Let's talk about the different types of addictions because, you know, we often think about drugs and alcohol, but it goes way beyond that.
Yes. So I think you're right. You know, most of us think of addictions as substances, but they can be things like alcohol, tobacco, cannabis, can be food. It can be gambling. It could be online gambling, going to not anymore, but going to the casino, that sort of thing. Some people can be addicted to work, which in our society can be looked at almost as a positive thing, but that in and of itself can be a form of addiction. There's also shopping, where we're spending lots of money, or even, social media, gaming, that sort of thing. So those are all different types of addictions.
And the interesting thing is that, it affects all demographics, all ages. It's sort of all the way across the board.
Mm-hmm. Yes, definitely. I think the next, I'll talk a little bit about what we see at camp, and then we'll get into the next part in a couple of slides.
Okay.
So what we see typically at camp in terms of what our kids are using is about 64% of them are using cannabis. 56% are smoking cigarettes or vaping, which is becoming a big, huge thing. And interestingly enough, about 50% of our kids are presenting with issues with technology or excessive gaming. Then underneath that is alcohol at about 46%. And then there's a big gap where around 8% of our kids are coming in with gambling or pornography addictions.
Yeah. Sorry, I jumped the gun.
Okay.
So
That's okay. That's all right.
And actually are really varied.
Yes, they're definitely. And so the other thing I just wanted also to touch on is, so when we have kids, when they've been diagnosed with a substance use disorder, the other things that we often will see is most of them are also diagnosed with an anxiety disorder or what's called a relational issue. So that's where they're having some parent-child conflict or having some struggles with relationships in their home. And then after that, it's depression. It's at about 50%. Then we've got kids who've got attention deficit disorder, another huge chunk of our population at about 51%. And then youth who've been diagnosed with what we call, which is post-traumatic stress disorder. So that doesn't mean necessarily that they've only had a trauma, but they've had it for long enough that they can get the diagnosis of PTSD. And we're seeing that at about 30 to 40%. So that's kind of just give you a sense of not only that they're struggling with substance use or behavioral disorder, but also that they're struggling with these mental health concerns at the same time.
Mm-hmm. Margot, I find it fascinating how drugs impact the brain, what happens in the brain with different types of addictions. Can you run through that physical aspect of addictions?
Certainly, yes. So essentially what addictions do is they almost hijack our evolutionary brain. So the reason that we like doing things is because they're good for us in evolution. So we like to eat, it feels good. And so our brain is designed to reinforce that behavior. So what happens with addictions is that, let's say we are having a bad day or something happens. So we use a substance and then that floods our dopamine receptors. And that's our pleasure pathway. So then we feel good. And so then what happens is we develop, that's a sense of a reward, and then it helps us feel better. So then we learn, so that's where it's related to learning, is that we learn that if we use this substance, we feel better. If we do this behavior, we feel better. So then that reinforces it. And then where it uses memory is our brain remembers, oh yeah, last time I was feeling like this, I did this and I felt better. So that's where our brain can be changed and will interact with the drug itself. And then also that's what leads to things like cravings and tolerance is the other part. Sorry. Trying to remember all this. Yeah.
Well, because it really is, it's a vicious cycle that happens and it's physically in your brain.
Yeah. So first we engage in the substance and then we feel a bit better. Then what happens is it starts to wear off and then maybe we start to feel guilty. Maybe we start to feel shame. Maybe the problem we were originally trying to escape from is right back in our face. And then the very thing that we were trying to avoid is there again. And so, of course, using a substance or doing a behavior doesn't take that away, but it's like a temporary vacation. And then now we're at an emotional low. And so then we reach for a substance or do the behavior. So that's how they sort of interact with each other.
Okay. How does this whole process begin? Is this something you're born with? How does this begin? What is there's something that triggers this, that begins this?
So typically what we look at is at camp, especially we use a biopsychosocial spiritual lens. So we look at what are our genetics? What are we born with? Were we exposed to something in utero? That kind of thing. So that's kind of what we're born with. Then we look at our psychology. So each of us has a different temperament, interacts with the world differently. So that's another piece that we consider. Then we have our social and our spiritual environment. So that might be the home we grow up in, the school we go to, the neighborhood we're in, and that sort of thing. So then those are all sort of like our foundation. And then we have things that maybe precipitate it. So let's say we've been bullied. Let's say one of our friends dies. Let's say our parents get divorced. So that might precipitate us to try a substance or engage in a behavior. And then there's something what we look at as perpetuating. So maybe I try the substance, engage in it, then my peer group shifts, and then the only people I know are people who are doing drugs. And so that would perpetuate my drug use. Or let's say I dropped out of school or that sort of thing. So they all sort of interact in a complex interplay. But I wouldn't say, we're not born with it. Our life gives us a series of circumstances and we make choices, doing the best that we can with what we know.
Okay, usually though, when this begins, it's usually impacted by something. There's usually something that happens that triggers a trauma of some sort. Would you say?
I would say that the research it can go either way. So It could be that I start using a substance maybe because I want to be accepted by my peers. And then as I continue to do that, that reward pathway in my brain gets impacted by the drug. And then if I then start to go off of it, maybe I have withdrawals, or then I start to develop a mental health concern afterwards. The other way around would be that something happens. So there's an incident, whether it be a trauma, whatever that might be. And then that leads to me wanting to escape that pain or to do something to try to manage it, to try to cope with it. And then that might start my progression into using drugs or alcohol or substances.
Okay, thank you, Marco. We're going to come back to you, but we want to introduce our other panelists. We have two others with lived experience, both very different stories, but both incredibly compelling. And I want to begin with Sasha Childs. So Sasha is 23 years old. She is a trauma and addiction survivor. She's also a mental health advocate and a member of Casa's Youth Council. I am so pleased that you're joining us here at Casa, Sasha. So we talked a bit about trauma. Yours, where it really started, where your journey really began, was with your dad. Can you tell us what happened?
Yeah, so my journey starts at about age 13. There's a lot before this, but this was the main event that happened in my life that caused a big shift. And I was 13 years old and my dad took his life by suicide. And that's really what kind of got the ball rolling and started changing my environment and all of the things in my life.
Well, it was a struggle within your family as well, right? So I don't know what kind of support you had, but that downward spiral was a whole combination of factors that began with your dad. What did that look like?
It starts off a little bit earlier for me. So my dad had untreated mental health and drug addiction problems. And so he was very kind of like a roller coaster throughout my life. I had a lot of childhood trauma leading up to his death. Just previously to his death, my stepdad at the time, he ended up in jail in August of 2009. And then February of 2010 is when my dad took his life. So I lost both of my father figures within just a few months. And then my mom had to support all of us on her own. So it started with her kind of needing to work 2 jobs, working full time. So I really had no parental figures in my life. And I decided that I was going to look for ways to kind of drown out all of the things that I've been dealing with and not wanting to cope with. And I found that in a different community of friends, which looking back now, it wasn't the right community to be in. Well, it gets a little hard to talk about.
Yeah. Takes a lot of courage to talk about this. You ended up leaving home, didn't you, Sasha?
I did. I was out of my house at the age of 16, and I lived in Fort McMurray at the time. and I couch surfed for as long as I could. And then I also ended up in a youth shelter for a little while because I didn't have anything stable in my life whatsoever.
At what point did you hit rock bottom?
Probably a few months after that point. My mom had gone back to work in the camps in the oil rigs in Fort McMurray, and so I moved into the house at one point, and I had a friend living with me and my sister, and that's when I started using cocaine very regularly. At first, I didn't think that I had any problem at all. I thought, oh, it's just a recreation drug. This is what teenagers do. In Fort McMurray, it's very easily accessible as well. So I started using cocaine on a daily basis. And the point that I hit my lowest was when I started to trade my body for drugs. Mm-hmm. And that was age 15.
Mm-hmm. How the heck did you climb out of that hole? What did you do? What happened? I mean, it wasn't it was a roller coaster for you, wasn't it? It didn't just sort of happen all at once.
Mm-hmm. So over about a year and a half in Fort McMurray, I was selling my body for drugs because as a 15-year-old, I don't have any income. I don't have a means to purchase that. And when you have a drug addiction problem, you find a way to get the drug that you need. Luckily, I didn't venture out past that much. I did use other drugs. Sorry, I sidetracked myself. Could you repeat the question again?
Yeah, it's okay, Sasha. You know, how did you start to dig yourself out of this? What happened?
I started to notice people around me in my life going to jail. People were being murdered. People were overdosing. And I knew that if I stayed, I was going to be one of those statistics. So I decided to leave. And I up and left Fort McMurray and never looked back.
Wow. What did you do? Did you do a step program? What did you do?
So I just started by removing myself from anything and anyone that was related to drugs. And it wasn't the easiest thing. And when I moved to Edmonton to get away from it, you still find yourself in those situations every now and then. But the one thing that I did was I made sure that I wasn't going to be that statistic. I wasn't going to overdose. I wasn't going to go to jail. And so I surrounded myself with people who could help. I did multiple kinds of therapy. I didn't do a step program, but I mostly just kind of worked on self-development and resiliency and made sure that I was strong enough to not go back to that place.
Okay, so I want to end your story on where you are today because it's pretty amazing. I mean, you are sitting in your own home that you own. You are married. Mm-hmm. You're doing renovations. You are back in school. Wow, that's a pretty incredible recovery, and in a fairly short period of time. How do you feel now?
It took a long time to get to where I am now, but I wouldn't trade any experiences that I've been through because it's made me who I am today. And I'm back. I'm doing my academic upgrading because I never finished high school. I own 2 businesses. Me and my husband own a house and we're renovating it. We have 2 dogs. And I'm just kind of focusing on myself and growing myself, growing my businesses, growing my life, and kind of moving on, healing from past traumas and all of those things.
We have a lot to learn from you, and I'm looking forward to this discussion. But before that, I want to introduce our final panelist. His name is Brent Coleman. Brent is a recovering addict who has literally been through hell and back. Maybe not literally, Brent. He describes his horrific and inspiring journey in an introspective article that's posted online. It's called Hell and Back, An Addict's Tale, and it is really a pretty compelling read. Brent has degrees in political science and sociology, and he's now an analyst for the city of Edmonton. He's an advocate for change in how we view and how we treat addiction. Thank you so much for being a part of this, Brent. So tell us how your journey began, because it began with childhood trauma as well.
It did. And just first, I'd really like to thank Sasha. What an incredibly strong woman. I'm very honored to share this panel with her. So thank you for sharing your story.
Yeah.
My story begins through a very tumultuous childhood and kind of ended with a very serious traumatic incident in high school. Substance use was a very strong pattern in my life for a very long time through my teenage years on a recreational basis. But all of that pain and trauma that I had been harboring around with me for so long finally caught up to me in about my mid-20s after university, and it came crashing in like a storm. And all of a sudden, those recreational fun nights turned into 2 or 3 times a day, every day, until I just brought myself to the brink of collapse.
Okay, so what triggered that?
For a long, long time, untreated mental health issues. I ignored, and as Margot said, it's not just substances that this behavior takes over. Early in my childhood, I used video games, I used candy, I used absolutely everything. And the big realization is the more that I've gone through this, it's marijuana, alcohol, all this stuff isn't the gateway drug. Just put simply, child and untreated mental illness is one of the biggest factors that I've met in people in through recovery. And it's one thing leads to another. And unfortunately for me, that escape from the pain that I carried around inside me that I didn't treat for so long needed stronger and stronger means of escape until I finally found very hard drugs that completely took over my life.
So Brent, your story is not what I guess most people would consider to be typical at all, because you were already quite successful. You have 2 university degrees, you've got this great job. How did you spiral? What happened?
As I said, it was one of those things where after all those things I was chasing for so long came to fruition, there wasn't that next thing, that next stimuli that kind of kept me in check. And the more I look back, I always thought like this wasn't a problem in my childhood, but it was a domino effect, and I was a storm waiting to happen. Finally, that push for success kind of came to an end in a bit of a bleak part of my life, and there wasn't anything to kind of hold myself to account to, and I just fell into it. And I guess the wave of that trauma that I was able to run away from, I finally ran out of breath, as a really bad metaphor, and it caught up to me, and it just completely crushed me.
So you were married.
I was
and still are.
Yeah, sorry. Yes, we had just gotten married at that point.
In fact, do you call her a sort of a superhero for the
she
things?
She is the true hero of this story. Yes.
So what happened with family and friends as you were going through all of this? And what point did you realize, wow, I have to make a change?
So what happened with family and friends is I slowly became disconnected more and more and more. Like every social bond that I had was snipped off my addiction. But one of the biggest misconceptions about addicts is it's through popular culture, we have this very specific idea of who is an addict. It's always a very, very vulnerable person. It's always someone that you would expect walking out of your apartment in a back alley that's on the down and outs. And what blew my mind entering recovery and the people I knew when I was in addiction is how far away from the truth that is. And don't get me wrong, those demographics are hugely disproportionately affected by this disease. But the overwhelming majority of us are 9 to 5 people who on the outside looking in seem to have their stuff together, that go home and struggle horribly with this. And it's everyone from nurses and doctors to your mechanics, to your carpenter, to your grandmother, to the nice kid that helps you at the grocery store. So really going through that, it's a real challenge because addicts are very good at hiding who they are in this kind of double life. There's your backstage yourself and the front stage yourself. And because we're so ashamed and we carry around all this fear with us, we're very good at presenting this forward appearance that everything's fine, or blaming other things that we're going through for the uncharacteristically behaviors that we start to exhibit as we get deeper into this disease. And that was exactly my story. Is I would stay up all night high. I would still somehow struggle to get through work each day. And everyone just thought I was going down the drain from something else until it all came to light. The night that it all came to light is we were speaking about hitting rock bottom. And for the last few months, while I was really heavy into active addiction, I was scraping the bottom of a rock barrel every day, where things like suicidal ideation were a way that I woke up every single morning, because I never thought there would be an escape from where I was at. And the only thing that kind of kept me from coming out into the open was that fear that once the few people that I hadn't left in my life, if they found out who I were, because they were the only people that were really kind of clinging or keeping me sane and kind of making me feel human again. If they ever found out what I was, it would all be over. And finally, there was some kind of unconscious part of me that got myself caught one night with my dear, dear wife. And that fear of abandonment wasn't what came into fruition. It was an outcry of support and love. And from there, that next morning when I sobered up, we did everything in our power for treatment programs to 12-step programs. And it wasn't an easy journey. It wasn't, once you've kind of seen the light and got involved, it's just a nice, smooth ride there. There was 18 months of relapses and struggles and fear and successes and failures and successes and failures. But the one thing that we did was stay persistent. Every time there was a mistake made, that it wasn't a continued mistake. It was, this happened, what are we going to do about this? Re-strategize and continue going forward, always forward.
Margot talked about the different types of addictions, but there are also different levels of addictions, right? I started smoking in high school, and I quit 4 years ago. I have no other issues with anything else, but I couldn't get rid of those darn cigarettes. So I consider myself to have a sort of a bit of an addictive personality. And so it is widespread. There are hardly any families that don't have stories of alcoholism at the very least, and different levels of it. You talked about, Brent, in particular, about how this is a really dangerous time for anyone with any form of addiction. Tell us about that.
It is. It's, for me, one of the greater dangers about this pandemic is when you look at a lot of treatment programs, the 12-step community is completely based around this. But it comes back to, there was a study done in the 1970s called the Rat Park studies, and it kind of goes back to some what Margot was speaking about. But when the war on drugs came, there was this belief that once you're addicted, you're kind of forevermore lost, and we kind of have to cage you up to society. But a Canadian psychiatrist actually looked at this. He said, this doesn't make sense, because we have a lot of normal people taking these prescription painkillers. They're fine, but the odd person becomes addicted. Like, why does it affect different people differently? Yeah. And it goes back to that trauma thing and the circumstances you find yourselves in and genetic dispositions. But ultimately, what Dr. Bruce Alexander found was people experiencing addiction find themselves in these isolated cages. And he proved this by using rats, where he set up little boxes, and rats with steady use of drugs all alone would very quickly overdose. But rats were there in this little self-fulfillment park with lots of other rats to play with and lots of activities, and just kind of like a general paradise. Didn't care about the drugs. They would use them, ignore them. So where this kind of draws back into addiction is the essence of addiction is it's a disease of isolation. And the trouble with this pandemic right now is everything that we're taught in recovery is to get out there, to connect with people, to give back to your community, to kind of re-experience being a social animal once again. And the trouble now is, in order to protect the health of the public, the best thing that we can do for everyone is putting ourselves back in the cages that we tried so hard to escape. And I think that, especially for people early in recovery or people that are on the kind of borderlands between having a concerning issue to being a full-blown addict, are going to really, really struggle with. And unfortunately, how we're approaching this so far, we haven't had a lot of supports for people, because as we've looked, I was speaking with a therapist friend of mine, and she was saying one of the big issues right now is her clients aren't able to afford her sessions. They've just been laid off. Their health insurance is gone. There's very little public supports for mental health. So in a time of constant fear with all these external stimuli that the world is ending and you can't reach out and do your normal support networks, even that essence of healthcare is being cut off and people are being left alone, which is a very concerning thing for me.
Wow. Marco, you're still treating, and you're trying to do it any number of ways. What are you seeing and how are you handling things with clients?
So what we've noticed with our youth population is right now, Casa is only able to do phone sessions with clients. And so we're working on if there's a way to do this kind of video conference or that sort of thing. But what we found is that it's more often the parents that want to speak with us rather than the youth. And so we're not sure if it's because of many youth have grown up more texting or if they're not comfortable with that. So we're trying to figure out ways to kind of slowly warm them up to the idea of talking on the phone. We're also creating a drive, a resource for our youth and for our families. So there are some online AANA sessions. There are some Smart Recovery online sessions. There's some, I think as this continues on, people are trying to be more creative about how we can still meet, even though it's virtually. So we are trying to develop our resources as quickly as we can so that we can have those available. But it certainly is, it is a concern, right? Because people aren't able to come and see us, and having that connection to us, I think, is a big part of some of our youth's recovery and their connection. So we're doing our best to adjust to the times and to be as available as we can. So we are still all going into the office, and we're just staggering who's in the office and the times that we're there.
Sasha, this is particularly difficult on, I'll say, younger generation. Whether you're a teenager in your 20s, this is a pretty social time in your life and a time when that connectivity is just so important. How are you dealing with it? And how are you seeing other people around you dealing with this period?
Particularly for myself, with my businesses, they're both online based. So I try to get on as many Zoom calls a day, a week as I can, get face to face with some people virtually, have conversations with them, reaching out to friends, reaching out to family members, and just trying to stay connected as much as possible.
What happens if you're someone sitting at home and you think, I don't have a problem, or there's an untreated type of trauma, and yet they're feeling unsettled. And talking to a lot of girlfriends, the big joke is everybody's drinking more wine. The liquor stores are doing delivery business. There's a lot more of that out there. Trent, how would you react to that? Because you said you have some concerns for some people.
For most people, there's not a huge issue with having a glass of wine a night.
Yeah.
I think it's important, especially right now, whether you've experienced addiction before or whether just someone that's growing concerned or just a member of the general public. But it's good to have a self-check-in. And as we spoke about before, it's the motivations why. Are you having a bottle of wine because you feel lonely, scared, and sad, which isn't a healthy coping mechanism? Are you having a glass of wine with dinner because you enjoy having a glass of wine? And it's the intentionality behind what that behavior is connected to that is usually, at least in my experience, a good way to identify whether there is something of concern there.
Margo, would you like to add to that? I can see you nodding.
Yeah, no, I think that's a great answer. And also looking at, are we hiding it from other people? Are we feeling too hungover in the morning or too tired in the morning to do our Zoom session? So are we starting to be secretive about our behavior? Is it impacting our daily life? So we're sleeping all day rather than going and enjoying the sunshine. And so when it starts to take away, or it used to be 2 glasses of wine and now it's 6 glasses of wine and then 12. So as we start to develop tolerance.
So my phone's been dinging like crazy from all the people who have questions. So Sasha, this one's for you. How important is it for young people to have a routine during this time?
Oh, it's absolutely important. I was not following a routine when this quarantine started, and I found myself getting back into a deep depression very, very quickly. Now I write my schedule out every single day. I give myself small, realistic goals, even if it's just make the bed, eat breakfast, and move my body. So maintaining a routine when you're isolated at home, it gives yourself variety. Make sure you schedule in self-care time for yourself. It's so important just to check in on your personal wellness, whether it's physical or mental, and just make sure you're connecting with people throughout your day too.
Another question, and this one is for you, Brent. It's talking about, okay, you've got family members or friends who struggle a bit with addiction issues. You want to help, but you don't want them to feel like you're imposing or you're checking up on them. So how do you provide support and let them know that you're there without making them feel uncomfortable?
For me, it really comes down to doesn't come around the kind of addressing the elephant in the room straight off the bat. As I kind of touched on, it's a lot of the big solution that we're finding through addiction, at least at the social level, is that reconnection to society and giving people, making them feel like their life is worth living. Because when you kind of find yourself in that isolated cage, that's when you start reaching out to unhealthy coping mechanisms. So if there is some concern, it's not about so much trying to get them to stop doing X. It's giving them other things to do. Maybe have a Zoom call and a hangout, play a game with them. There's lots of great activities that you can do with people. And it's really just reaching out and making sure if they need you, you're not there for them. One of the biggest things I found too is, unfortunately, if they are experiencing addiction issues, it's one of those catch-22s. As much as you want to help them, it's a very personal journey where they'll never come out of it until they're ready to come out of it. And unfortunately for that, it's one of those situations where there's at times you have to know your boundaries, but you never want to leave someone in that situation. But at the same time, you'd also don't want to develop the codependent relationships. So develop those boundaries, but always try to be a positive influence in their life where they're not going to feel ashamed coming to you for a problem. But even if they're going through a troubling period, just be there for them. Make sure they know they care. Try to find healthy activities that you can do together, even through the current circumstances that we find ourselves in.
Sasha, when you and I were talking, I asked you, what kind of advice would you give to your sister?
Yeah, I was thinking about that before we hopped on here. And so my sister is a drug addict, and she has untreated mental health, and it's been like that for a long time, as long as I can remember. And I was thinking, what if she was listening right now, what would I want to say to her? And I would tell her that, like, Jordan, I love you so much. And I hope she knows that. And whenever you're ready, or if you need anyone, you need help, you just call me. Because you have a family that loves you and will be there for you. And I know you can get through this. I got through it. Millions of other people can get through it. And we can do this together. And I will hold your hand through the whole thing.
Wow, that's really powerful. Thank you. Margot, someone else wanted to know about camp.
Okay.
How they access services at camp. Do you need a doctor's note? Can anyone do it? How do they find out more and look at accessing?
Mm-hmm. So the camp program is one of the, I think, 2 programs at Casa where it's a direct referral. So youth can refer themselves, teachers or counselors can refer to our program, families can refer, or doctors can refer. So we take referrals from anybody. If you go to casaservices.org, online there would be a link to our program. And so there's a referral form on there. Individuals can fill that out on their own. and then send it in, and all of them come directly to me, and I review them all and we book them all in. So we're a pretty small program, only 3 therapists, so we're fairly accessible at this point, and more than open to questions if people want to call me as well.
Okay, another question is for someone who's feeling triggered while home alone and feeling the urge to use a substance, what would you suggest that they do instead? Sasha, do you want to pick that one up?
Yeah, sure. I definitely still struggle with triggers, and what I try to do when I find myself in those situations where I could easily access marijuana again, I could easily access any type of substance. So I always have to start by reminding myself, Sasha, like, look how far you've come. And Sasha, you know what will happen if you use once. So I know that I cannot use one more time ever again in my life. So when I feel those triggers, I try to start doing something else. I try to distract myself with healthy things. So talking to my husband, talking to a friend, play a game, make a meal, just kind of find something that you can replace that negative trigger with something positive, and just try to rewire that trigger in your brain and replace it with something great.
You know, Brent, you said that this is not something you can deal with willpower. This is not something you can will necessarily to change.
Unfortunately not. And there comes a time later on that I believe that you start getting your reasonability back. But as Margot went over, the entire process in your brain that determines reasonability or rationality and reason and how you react to your environment has been replaced by your response to immediately seek this. So especially early on, it's one of those catch-22s where relying on your willpower simply can't exist, because your willpower is rewired in your brain for the next little while to immediately seek out these drugs. So at least in the 12-step community, I know in SMART does this quite a bit as well. But even if you're not a part of those communities, have 2 or 3 people that you feel comfortable with calling day or night, whether it's good, bad, ugly, and be that your first reach out. That's absolutely incredible that when you're kind of going through that part and you're arguing with yourself, to have a second person you're able to download a bit off of and to kind of be that voice of reason who may not be experiencing that right now, because it reminds you of all the good stuff that you have that you're not thinking of. Another really effective tool that I found that I learned from Smart Recovery was just a simple pros and cons list. It's you play it out in your mind that this reaching out and using right now might make me feel better for the next 5 minutes, but what do I have to lose? I could lose my house, I could lose my marriage, I could lose my self-respect again. All these wonderful things that I've spent the last few years rebuilding would be gone with the wind, because at least I remember from the couple of relapses that I had, it was a very, very horrific experience where one simple 5-second mistake ended up in hours and hours and hours of pain. So it's not, the struggle with this isn't actually the tools themselves. It's all a very, very simple process. It's bringing yourself to do that instead of taking that reaction, and being able to have that sober second thought of taking a step back and calling one number first before your dealers. And that, whether that's a family, a friend, a sponsor, someone you rely on, that can give you some perspective.
Margot, what do you tell your clients? How do you help them to cope?
Well, and I would agree with what everybody has said already, and I think those are all great tips. I think the only thing that I would add to that is around self-compassion. So recognizing that it's a hard time right now, it's a hard time for everybody. And if we are starting to have that little, that voice in the back of our head, there isn't something wrong with us, it's nothing to be ashamed of, but to then make the next step and choose the choice that we want to make. So it is a really difficult time and it's unprecedented for all of us. And to just recognize that, this is hard.
Okay, one of the things that's particularly hard right now when we're talking about addictions, there are a lot of people who are at home, isolated at home alone. I would say probably a quarter of the people that I know are. You think about students who are in residences, or people who never thought that they'd find themselves in this situation. What do you tell them help them in terms of, if they're on their own and they don't have that community, that person to talk to, how do they deal with triggers and with the urges that they might have? Margot, do you want to pick up on that?
Sure. So there's a whole bunch of different websites that people can go to, depending on if it's a trauma trigger and they're having a flashback. That would be a different resource maybe than if they're starting to have a craving for using. So there's lots of different things online. There's apps that you can sign up for. I'm on one where every morning it sends me a motivational quote, or there's sobriety apps where you can punch in things about if you are having a trigger and how to cope with it. So there's lots of virtual things that you can do if you don't have a support group that necessarily don't take the place of it, but might also be something a person could do in the interim.
Okay. Did you want to add to that, Sasha? Was there anything that you've seen with people who are home alone, with all the people you've been reaching out to, that you've seen that might help people?
Nothing that's popping up right now. Maybe Brent has something he can share.
Yeah, just to add on, there's a lot of great public resources as well. I know CMHA has a 24-hour imminent distress line that you can call in and seek some guidance. A lot of recovery communities have digital meetings that are on at all times of the hour that, even though it's complete strangers, it's a lot of the same experiences, whether you're in Canada, America, England, China. Whereas really cool, actually, the global community through this is banding together in those. So yeah, there's definitely a lot of great resources, either online or within our community. I know AHS also has a helpline you can call in through this. And sometimes that's all it takes. It doesn't even need to be someone that you know. It could just be a stranger on the other end that is there because they care.
Okay, so go ahead, Sasha. Did you want to add a comment to that?
Yeah, I was just gonna say that the distress line, I have that number saved in my phone for many reasons, whether it be if I have a trigger, if I have a mini meltdown or anything, if I'm feeling like I have a panic attack and I don't know what to do. The distress line has helped me so many times. So it's a great number to have.
Okay, let's talk about some of those online resources. Someone wrote in and said it's a good time to access some online support groups. And I don't know these groups, maybe Margot or Brent or Sasha, you can jump in with who these people are. First of all, sorry, my phone keeps jumping around. AA, NA, CA, and Smart Recovery. Good online resources. And Margot, just in addition to that, someone else wanted to know whether or not Casa services are free.
Yes, Casa services are free.
Okay.
And what I would just add to that is, and maybe Brent can speak to that more in terms of the recovery piece, but in relation specifically to youth, Kids Help Phone is accessible 24/7, and they have a text line where you can text in, I think it's 686868. I don't have it right in front of me, but then you can text in and you can interact via that way. And there's lots of, I know for parents who have a youth or family member that might be struggling with addictions, there's a group called Parents Empowering Parents, which is PEP, and they're doing online meetings now instead of their in-person meetings. So there's also support groups for people that are supporting people.
Brent, you'd mentioned to me that it's it's really important to reach out and to support groups. Did you want to add any support groups?
No, I think that's quite well covered. I know it's a difficult thing because in the 12-step program, there's the anonymity aspect and you're not really allowed to identify with any specific one. But I will say that I've been part of all the ones that you've listed. They're all a bit different. They're all very excellent. And if you're either early on in the struggle and you're trying to find one, I would seriously consider and suggest kind of attending as many as you can from different perspectives, because they're all a bit different. Some people drive with one, some people drive with another. Me, I kind of get different parts from all of them, so I kind of bounce around to different things. Yeah, so they're all very, very good, and it really just depends on what you kind of feel is going to be the best for you. But definitely, if you're early on, it's take a very wide berth of trying to experience as much as you can. And as I mentioned before, is the support groups and are really, really good for tackling the addiction side of things. But if you're like me and many others, seriously consider mental health supports, such as the services at Casa if you're a youth, counselors if you're an adult, or kind of anything you get a hand on. Because that's what really I found the change in my life is resolving my issues with my mental health with my therapist, resolving my addiction issues through recovery programs. A multifaceted approach is definitely the most effective because you kind of start tying off the loose ends of your struggles in different ways, and it kind of really forms together in this beautiful life once again.
Wow, that's really good. Comments people are making. Another great resource is 393-393, text for hope. And someone else made a comment saying people are experiencing a lot of loss and grief right now. So stay strong and reach out for help. That brings up a point that we haven't talked about, and that's stigma. So part of the reason why people don't reach out for help is because they don't want to appear weak, or they don't want to. It's a pretty incredible thing, even what you've done coming here publicly and talking about your experience with addiction, because there is a lot of stigma around it that stops people from talking openly about it, or at least admitting that they may be struggling. Anybody want to comment on that? Your experience with stigma? No?
No, I'll go. I was just waiting to see if anyone else wanted to. No, that was what kept me sick for so long, was the fear of being stigmatized and the fear of abandonment. I mean, it's very early on I realized I was a problem, and I just watched my entire life burn around me for 12, 18 months. I can't even remember how long it was. Like, I would be sitting at work writing down how much trouble I was in and how much life's getting away from me months and months before I got well. But pulling that illusion that I was hiding behind down was the scariest thing in the world until it was forced around me. For a lot of people, it could be very life altering. You could lose your job, unfortunately, lose your licensing. There's a lot standing in the way because of stigma that prevents people from coming out and seeking help. I know one of the huge issues that we face, that some people I faced, was single mothers who are fearful that their children will be taken away if they get into a recovery program or apply for treatment or something like that. And on the other hand, it's just the fear of loss of family. When you're in active addiction, there's very little that you have left that's kind of tying you into sanity once again. And you're scared that once you cut those away, you'll have nothing left, and that's the end of it. So I think if someone comes out to you, just a general feeling of support and lack of judgment is greatly appreciated. And there's a way to help them seek help without feeling judged or dirty or anything like that. Yeah.
Marco, you mentioned that a lot of parents come and talk to you about their children. Do parents have to get to a point with their children where the concerns get so bad before they'll come and talk to someone? Or at what point should they really start to look at reaching out for help?
I think it's a complicated answer. So sometimes it's the parents who want the youth or the young person to change, but like Brent was saying earlier, that a lot of it's an individual journey. So sometimes parents will bring their kids in and the kids don't want to have anything to do with us. But it is that part about, reflecting back to them of, I think something's going on or something's different, or, school used to be this way, help me understand what's going on. So it's very delicate, but how to have that conversation from a place of concern and curiosity rather than blaming and interrogating. And I think as a parent, that's really hard to do because we're worried about our kids and we don't know what they're doing and we know something's happening. So it's complicated, but we know that earlier intervention is better. And certainly, I think any therapist, but at the CAMP program, we try to meet youth where they're at. So the last thing we do when they come in is say, you need to do this and you must do this. It's getting to know them, getting to understand them, and then co-creating with them. What do you hope to do by coming here? And very often it's that they want to get help with maybe anxiety or depression or trauma. And less often, the first thing they want to work on is maybe substances. But again, I think it's that, like Brent was saying, that there is that stigma, and there's still that morality around it. So lots of people think addiction is a choice and mental health is not. But really, they go together, and I don't think you can separate them out.
We're going to be closing up. We've got Dr. Dina Hinshaw, who's going to be giving her report shortly for the government of Alberta. I'd like to hear sort of final words, final things that you'd like to leave the audience with from your perspective before we sign off. Brent, would you like to lead on that?
Sure. I think just as we continue through this, it's going to be very important for whether our viewers who may not be struggling with something, or for people who may be worried about falling into addiction through this crisis, just to be very regimented and thoughtful about how they approach every day. And as Sasha was saying, like, routines are great. I did my best to adapt my everyday routine, and it's kept me sane being isolated. But it's also, for the rest of us, it's definitely a time where we need to ensure that we continue to be compassionate with one another. Everyone's going to be going through their own personal struggles. And unlike this whole crisis is kind of precipitated on us going against the very nature of what makes us human. And when you do that, it's going to cause some very different behaviors coming out in people. And I think as long as we watch that with ourselves and mitigate those risks as much as possible, we'll be fine getting through this.
Yeah, and learn to laugh a lot too.
Yeah, exactly.
Find some humor and things. Sasha, what would you like to leave with?
Yeah, I do want to just touch a little bit about the stigma while I'm kind of closing up. But I really struggle with the stigma surrounding addictions and mental health, because I was dealing with my addictions prior to realizing that I had mental health problems as well. And one of the biggest things that's helped me through therapy and through reducing stigma is to share. And that's why I share with as many people as I can. That's why I decided to volunteer to speak today, is because when we share, we create connections, we inspire, there's a sense of community. And I hope that people know that there's other people out there in the world who can help, who are in the same boat as you, who have the same struggles, who have similar struggles. And there's tons of resources out there. And so I hope that everyone just knows that they are accessible. They're very easily accessible. Google has everything you need to know. So I just wanted to end with that.
Wow. Thank you so much, Sasha. Margot, what would you like to end on? Final words.
I would like to thank Sasha and Brent just for sharing your stories. And I think it's really brave of you. And also, I think it's really appreciated that other people can watch and listen and think I'm not alone in this. So I just wanted to thank you both for that. And I would say I'm just going to agree with everything, like the routines, all those pieces. The only thing I would add is let's be mindful about how much news we're watching. Maybe we do it once or twice a day, but not to be in front of the TV all day, hearing about all the bad things that are happening, because then our mind starts to run. So doing something, for our body, like exercise-wise, eating-wise, something for our mind, whether it's breathing or meditation, and then something maybe to make us laugh. So just kind of looking at our life in a balance and trying to keep some semblance of that as much as we can.
Well, this is just the beginning. We're in this for the long haul. We don't know how long we're going to be isolated for, and where things are going to be going from here, and the kinds of things that we're going to be dealing with in terms of the stress levels that we just don't know. It's that real uncertainty, and so maybe we'll do this again in another month or so. And sort of check back in and see what kinds of things that we can offer to people. Thank you so much. The three of you have been so amazing. And again, Sasha and Brent, thank you so much for sharing your stories and being so open. And Margot, for sharing your expertise. And this is actually going to be, it's being taped. It's going to be available on the Casa website. There's also a number of other resources on the Casa website at casaservices.com, or no, Casa Services, I think it's .org. And so we'd like you to check that out as well. We're going to continue the web series next week. Tuesday, April 14th, with Dr. Ted Jablonski. He's an award-winning family physician and really engaging speaker. And we're going to be talking about practicing self-care in a pandemic and the time of social distancing in our series on the pandemic's impact on mental health. If you'd like to support Casa, we'd like to keep providing the services. Even if you enjoyed this series, if you'd like to support some of the services that Casa does, we would love that. It can be $10, $25. It can be whatever. Just your support would be fantastic. You can text Casa at 393939 for more information on how you can do that. So now stay tuned at 3:30 for the daily coronavirus update with Dr. Dina Hinshaw. I think she's the latest Alberta hero to come out of all of this. She's Alberta's Chief Medical Officer at Health, and she's going to be speaking at alberta.ca. On behalf of Casa, Child, Adolescent, and Family Mental Health, thank you so much for joining us. I'm Leslie McDonald. Take care of yourself.